Good morning, everybody. We're going to go ahead and get started. This is the Direct in Your Practice Workflow webinar. Thank you all for joining us this morning. We're going to be discussing today how to integrate direct communications into your practice workflow. The dial-in for today's call appears on the right-hand side of your screen, as does your access code. After your access code, there's a usually 2-digit audio PIN, which if you enter it will allow you to ask questions over the phone at the end of the webinar when we take questions. The webinar itself will last about 30 minutes. You'll also be able to ask us questions through the questions tab that you also should see on the right side. You can ask questions there at any time. If there are technical questions, I'll try to answer them as we go along. Anything relating to the presentation, we'll take all the questions at the end. If you have any other questions after the presentation, you're welcome to email me. My email address is, as you see it here on the PowerPoint. Today we're going to be recording the presentation, and we will send out both the presentation and the recording of the presentation afterwards so that you can review it at any time. I'm going to go ahead and introduce today's presenters. My name is Rebecca. I'm the Director of Marketing Communications for Secure Exchange Solutions. Jeff Salmon, our Healthcare Solutions Architect, and Michelle Darnell, our Vice President of Business Development, will both be presenting today. We're also pleased to have with us Mr. Kevin Hodge, the Director of the HIT Division of the Virgin Islands Department of Health, and Ms. Kathleen Greenaway, the Direct Project Manager for the HIT Division of the Virgin Islands Department of Health. At this point, I'm going to turn over the presentation to Michelle, who's going to get us started today. Again, thank you all for joining us. And if you have any questions technically related during the presentation, I'll try to address them immediately. Thank you.
Thanks, Rebecca, and thank all of you for joining us today. This is the third webinar in a learning series that we've put together with the Virgin Islands Department of Health to talk about the use of direct in the health information exchange setting. So this webinar builds on our earlier sessions where we covered basic information about direct and the fact that it's a nationally recognized standard for secure exchange of health information. As a part of the Territory's Health Information Exchange Initiative, the Virgin Islands Department of Health and the Health Information Technology Division will continue to host these series over the next few weeks to get providers started with the use of direct. And the series is really in advance of a launch of direct HIE efforts in Q4 2012. I'm with Secure Exchange Solutions. We are what's known as a Health Information Service Provider, a HISP, and we're helping to facilitate direct exchange in the Territory and basically providing the secure message routing between trusted entities in the Territory using the direct standard. Topics that we'll cover today are the following. Just going to recap some basics over on direct for the new participants today, and then move into several use cases in terms of how direct is being used in the practice setting, and then follow up with how direct can be integrated into the practice workflow. So we plan to spend more time with demonstration of direct in the practice workflow during our session this morning. And then we'll finish up with some basics about getting started and open the floor up for questions, as Rebecca indicated. Background and recap of what direct is. The Office of National Coordinator defines direct as a set of standards and policies and services that enable simple, secure transport of health information. What we think is most important about direct is that it is simple to implement and to connect healthcare stakeholders using a universal addressing scheme. very important. It's secure. It's secure internet-based communications. Users can easily verify messages are complete, and messages will not be tampered in travel, which if you're not using security methods, that can often be an issue. It's scalable from the smallest office to a large enterprise setting that may be interested in including Direct as part of their provider engagement and outreach program, and it's standards-based. So those are the key principles around Direct that will make it something that's ubiquitous in the health industry for information exchange. So just some common threads and basics about Direct in general. As I mentioned, it's universal addressing and transport. We'll learn a little bit more about that. There is a component of Direct that ensures identity and also encryption from the sender to the receiver endpoint. It's a standard. It's not a proprietary approach. It's a standard which lowers the cost of entry for participants and also for vendors that are developing products for the healthcare industry and need to implement connectivity for all of their customers and to support meaningful use. Who can participate in Direct? Any healthcare participant that needs to send or receive information can get access to products and services that will support Direct. And there are a number of mechanisms that are available, ranging from EHRs and PHRs and lab information systems, which are Direct enabling their products, web-based services, web-based portals that enable users to log in similar to webmail and receive their messages, and clients as well, so email client plugins such as Outlook and other specific clients that may reside on the desktop. What are some examples of Direct usage, and how do they, this is just a subset, but a few, and the one that we're going to focus on today is the simple referral, where the solution for this is a combination of Direct and a clinical summary, or Direct and a combination of referral notes. Our last session, we talked about the use of Direct for exchanging provider notifications, where we combine Direct as the secure transport plus a notification that is that comes from the ADT admission discharge message in a hospital. Other scenarios that we'll be talking to in future webinars range from health reporting for immunization needs to lab results and the exchange of lab test results. For your practice, what kind of benefits can you expect? These we've covered in some of our earlier sessions, but for newcomers, just to recap, basically Direct can help with a reliance on fax and paper. It can cut costs in that area, cut administrative costs, and most importantly, speed up transmission of patient information. As you learn to implement Direct in your practice, it helps with care coordination and transitions of care and referral exchange as well. So what's really needed to implement Direct? Step one is you need to create an account with a HISP, an entity similar to SES. And what you'll be doing when you create an account with a HISP is you establish what's known as a direct address for your organization. So practices generally might set up a direct address for the organization, and they may also set up a direct address for individual professionals within the organization. The secure address is associated with the digital certificate. And then, as I mentioned earlier, you need a Direct-enabled client to send and receive Direct messages. and there are a lot of options there for you to consider. And then lastly, you just need to know, similar to email, what the direct address is for colleagues and other organizations that you intend to exchange clinical information with. And there are different ways that this happens in the industry today. In some cases, you might get that information from a directory. In other cases, you might get that information just like you would a fax number today over the phone. So messages, secure messages, are sent to and from direct addresses, and so direct secure addresses. Secure email is not generally sent to just your normal regular email address. So the scenarios, we're going to transition over to how direct can be used in the practice, in your practice workflow. And there are several different scenarios that we intend to focus on. The one that is probably the most useful in the scenario is when, in your practice, is when your EHR is fully implemented and direct enabled. Another scenario might be that in your practice today, you have an EHR, and you probably have a fax, and you may have a fax server in your practice or a scanner, but the EHR is not yet direct enabled. I think this is a fairly common scenario today because we're at the early stages of EHR applications rolling out direct messaging as part of their products. Another scenario is your practice has no EHR, so you have a collection of tools within the environment, and you want to use direct to exchange information with others, and you don't yet have an EHR. And then lastly, one other scenario where direct may come into play is with patient-doctor communications. So what you should see on your screen is a scenario of a direct-enabled EHR. And this is a specialty EHR for the eye care industry that have actually embedded direct as part of the workflow within the electronic health record. So you can see on the screen we're in a patient record, and there's a need to actually send a referral and problem list to another participant, and it's a embedded part of the electronic health record user interface. The workflow that we're going to see live and in action is a setting where we have the practice has an EHR system. They've got a fax server capability, faxes either arriving as electronic image or they're arriving as a paper image and being scanned. These images are then opened, and then they're attached to the EHR patient record. And so this allows direct to be embedded into the existing workflow, because in most cases from the electronic health record, in this setting, the electronic health record is also taking in fax images as they come into the practice setting. And then the third scenario is there's no EHR in the practice setting, and the physician would be using a direct-based webmail product to exchange notes and referrals and lab results with colleagues and perhaps also with their patient. So at this point, I'm going to turn our session over to Jeff Salmon, who will demonstrate some of these scenarios. And with that, Jeff?
Thank you, Michelle. What we're going to show today is actually the use of direct in action. We're going to, as you see on the screen, a patient is going to go to a physician, going to a follow-up exam post a hospital visit. The PCP will be notified, has already been notified of the patient discharge. They're going to receive a continuity of care document, which incorporates structured data from the physician, from the hospital. That physician is going to receive it. They're going to save it into their electronic health record. That electronic health record is not a tightly integrated system like Michelle had mentioned earlier, but does have the ability to import CCDs, and we'll show you how that works. Once he receives the email and the CCD, he is going to recommend a blood test. He's going to receive the results of the blood test and then take those lab results and email them to the patient, who has his own direct email address or her own direct email address and a Health Vault personal health record account at the Microsoft Health Vault site. So what we're going to do is we're going to show all that right now. And I'm going to just switch over to another screen. This is the direct address webmail account, so I'm going to log in to the HealthMail account now. And the first thing that it shows me is a bunch of emails that I have yet to read. So the first email, it turns out that it's about patient Maria Jackson. Notice the email note inside. Please see the updated continuity of care document for patient Maria Jackson. I suggest a glucose tolerance test to follow up on the diabetes diagnosis. So what I can do right out of the web application itself, the direct SCS Direct, is I can show the continuity of care document. Unfortunately, the continuity of care document is a computer-readable document and not a easily human-readable document. So what we're going to do with this is we're actually going to take this document, we're going to save the document to a directory, and then we're going to go into our EHR system. So our EHR system that we're using just for demonstration purposes is a product called Practice Fusion. This is Practice Fusion. We can look at patients here. At this point, I'm actually going to go look at documents. And because I've received a document via email, the product does not support an integrated receipt of that attachment. I need to actually go into the system. I need to pull up that file, and this is the CCD document that I've received. This EHR system allows me to associate it with a patient, and we're going to associate it with Maria Jackson. It's a CCD document for Maria Jackson. That's the name of it. We're going to specify the type of document. In this case, it's a continuity of care document. The receipt was today. I can assign it to a provider or just click on Assign it to me. And I'm just going to put a note in the comments. I'm going to hit Save. And I've successfully uploaded that file. If you notice, this is the document itself, and it's now been incorporated into the application itself. It's also been, it's been associated directly with the patient Maria Jackson. So I can actually go through and I can view the document itself. This is that XML file that you saw that wasn't really easy to read. At this point, it is easy to read. It gives you the patient information, the date of birth, all of the information associated with it. Looks like she has this gestational diabetes and a couple of medications and allergies that that are associated with her information. So what we're going to do at this point is I'm going to, as a physician, I'm going to ask for a glucose tolerance test. I'm going to receive the results of that test from the lab, and I am going to now send that message to Maria Jackson herself, and she has a Health Vault account. So I'm going to say lab results. and then I'm going to attach a file. So I simply go to the location of the file, and here's my glucose tolerance test. It looks like it was done yesterday instead of today, so I'm going to change the date, and I'm going to go ahead and send that document. So as you can see, the user interface for the web version of Secure Exchange webmail is very easy to use. It gives you all of the inboxes. It lets you save your items on the side. It lets you check mail. You can move things to folders, create a new message as simple as clicking on New Message. And then there's some other administrative functions up here. You can change your account information and such. What I'm going to do now is I'm going to go sign into Maria's DirectAddress.net account. And as a doctor, I should probably not know her account, but we're just going to pretend. And it looks like the Microsoft site is a little bit slow. Okay, so at this point, I can simply go to the HealthVault Message Center. I can see that I received an email this morning, and I can see the note. I can see the Maria Jackson glucose tolerance, and I can actually open that up as the patient, and I can see the document itself. So here is Maria Jackson's. Here's her visit dates. Here are the results of her glucose tolerance test. It does not look like it's great news, but it is something that it's important for the patient to know. And this is the information that was sent directly to the patient itself. So that's more of a full cycle. We received the data from a physician. We took that data. We put it into our EHR system. We can view the data inside the EHR system. We can send messages from the system. We can then receive lab results and then forward those lab results to our patient themselves. And at this point, I'm going to pass the baton over to Rebecca. So if you have any, we can just move on from here. Thank you.
Thank you, Jeff. So we have gone over today several of these case studies, so hopefully that's given you a good idea about what Direct can do inside your practice. There are a couple of others which you can see when we send over the presentation. So we've talked about how Direct requires an account either for your organization or as an individual provider. And when we're ready to get started, which should be in mid-September, you'll be able to register your organization and individual physicians through the Virgin Islands Department of Health. That will pre-register your organization with Secure Exchange Solutions for Direct Communications. You'll then be able to verify your registration details, register individual professionals, and then you'll receive your direct email and certificate, and you'll be ready to go. So we went over what Direct requires in terms of account. We talked about use cases such as referrals, patient care coordination, provider notifications, lab results delivery, and patient communications. We talked about how Direct can be accessed through webmail, through the client, and in some cases it can be integrated into your EHR system. And we expect Direct to be available in the fourth quarter of this year through the Virgin Islands Department of Health. At this point, I'm going to ask if there are any questions. You can feel free to type questions in your chat screen, and you can also ask them by audio. I'm going to go ahead and open up the audio controls, so anybody who has entered that audio pin will be able to ask the question.
Muted.
In a minute. If you have not entered your audio pin and you would like to be able to ask a question, please enter that audio pin followed by the pound key now. Okay, does anybody who's on the line have any questions?
I do. Can you hear me?
Yes, I can.
Yes. I'm calling from the Medical Institute. My name is Dr. Christian. I wanted to have that the Institute right now has a limitation in being able to send secure information. So I'm assuming from the first slide that not only physicians but institutions would be able to use Direct. So that's one question. I'm going to ask the 3 questions. Number 2 is that how can we help to get other institutions knowledgeable of the fact that they can use this if that is true? And then number 3 is there going to be a registration form that we can fill out even before the 4th quarter so that we'll be up and running the minute this is available?
Okay, Michelle, do you want to take that question?
Sure, absolutely. Thank you. Thanks for great questions. So in the first question is how can we help get other institutions and make them aware of Direct. We are, at SES, we are at your disposal in terms of if we need to put together some specific group web sessions or educational sessions on Direct. We are more than happy to schedule those for you. If you've got some recommendations on institutions that we could call on, we're also happy to call on them directly to help explain the value and the benefits of Direct from the institutional perspective. And absolutely, we focus this session today in the practice workflow because we often get questions about how this can be integrated, into the practice workflow. But the great thing about Direct is institutions, labs, system vendors, practices, therapists, long-term care, behavioral health. I mean, the list is limitless in terms of who can take advantage of this because it is a universal standard, and I think that's what makes it so powerful for the industry. It's not a proprietary approach to exchanging information. The other question around, so hopefully that addresses a question around can institutions use it, and how can we help. We also have material available, and I'm sure that if you reach out to Kathleen Greenaway that they will have material as well that can be shared that basically briefs on what the Direct program is and how it can add value to your organization. We're happy to help with that. If you want, we can reach out directly to you after the session and be happy to share information and articles that might be useful. And then in terms of sign-up, I am going to refer that Kathleen Greenaway is probably the best person that you could contact on that, and she could get you going in terms of the application approach.
Yeah, because this is Dr. again on September, the 2nd Saturday in September, the Medical Society meets, and we send out in the next week to all the doctors the notices, so we could include some information on this so that the doctors in the territory can do that. And this Friday we'll be with the health center, so we would love to help partner and get the information out. That's
wonderful. That would be a wonderful opportunity.
And Michelle, I opened up the line for Kathleen Greenaway to speak as far as a registration form. If she has any comments to make at this point, we can do it, or we can just defer to later.
Yes, this is Kathleen. Thank you, Jeff. Dr. Christian, I really appreciate, first of all, your volunteering to pass on information through your group, and we will certainly be taking advantage of that. Just wanted to recap something that I put out on the earlier calls, which was that initially when the exchange goes live, what we'll be doing is running a pilot group. We're not limiting that pilot group to a specific number, but we're hoping at a minimum to have the hospitals, the health centers, the Department of Health, some specialty care providers and general practitioners, a small, tight group that we will use to work out the kinks and do some testing of data sending. Once that period is over, which we anticipate will be at the end of the calendar year, that's the point at which we will be opening the exchange to the entire care community in the Virgin Islands. Between now and the end of the calendar year, we will also be working one-on-one with providers of all types to collect all the information necessary to have SES have their identities verified. That providers will then be able to go directly to the web hosted solution and sign up. We have a moderate amount of exchange addresses and accompanying digital certificate that will be available free of cost. So those who approach the system and sign up first will benefit from a year's worth of free subscription to the service. And Dr. Christian, we can talk offline about how many addresses you would anticipate needing for your particular organization and your participation in the pilots as well.
Great. But just to let you know, we're here to help.
Thank you so much. We appreciate it.
Okay, thank you so much. Does anybody have any other questions over the phone? Okay. Nancy Morissette had asked if we know yet what the cost would be. I think that Kathleen probably just had answered that question. If anybody had anything to add, we're welcome to take any more questions at this time. Okay. Thank you all so much for your participation this morning. We have 2 more webinars ahead of us. On August 28th at 9 a.m., we will be having a webinar on using DIRECT for behavioral health and immunization reporting. We'll get in depth into those specific uses and how DIRECT can help. And then on September 11th, our program should be live, and we will go through how exactly to get started, how to sign up, how to use DIRECT. It will be a very hands-on webinar, and we will be taking any questions on how to start your practice with DIRECT, make sure everybody gets registered, and really get going and using this product. Thank you all again for joining us this morning. Again, if you have any questions after the fact, you're welcome to contact myself or Michelle. And we look forward to seeing many of you on the next webinar. Thank you.